Now, I've been talking a lot about mental health this morning, and that's because the Health Secretary has talked more about his plans to treat an extra 1 million mental health patients over the next 4 years. Jeremy Hunt says the £1.3 billion boost will see thousands of new NHS jobs. Well, joining us to discuss whether or not this will make a difference is the psychotherapist Noel Bell and Young Minds Policy Chief Dr. Mark Bush. Good morning to you both. We have been speaking to the Health Secretary here on Sunrise this morning, and Dr. Mark Bell, he described his plans as ambitious. Others are saying they are unrealistic. What do you think?
Well, they definitely are ambitious, and we really hope that they will materialise on the ground. But in reality, CAMHS services are really stretched. Professionals are telling us that they have too much demand for the services, and they're just worried about having that workforce in place in 2020. And even if that workforce is in place, we know that it's only going to meet the need of 1 in 3 children. So 2 in 3 children will still be left without vital support.
Noel Bell, a lot of people have called into question, a lot of people within the NHS have called into question this timetable. Jeremy Hunt saying within 4 years there will be 21,000 new mental health professionals. And people who know anything about training mental health nurses or psychotherapists or any kind of therapist know that it will take longer than 4 years.
Yes, I mean, the government will say that it's existing staff as well who will have their skills updated, so that is feasible. But I think the key issue is improving access as well as increasing quality. So it has to be seen in those terms, because it's one thing to increase the access, we also have to make sure that there's sufficient number of sessions for patients and that they get good quality care as well as a range of therapies. Traditionally, the NHS has been pretty fixated on one approach, CBT, and I think psychotherapists would like to see more of a holistic and a range of services rather than just one approach fitting all.
When you say that, Noel, what exactly do you mean? What exactly do you mean when you say more access, a more holistic approach? Because you're very right, when it does come to tackling mental health issues, if a young person goes to a GP, say, and says, look, you know, I'm having issues with depression, issues with myself, with security, the waiting list to see a therapist for free is incredibly long, that in the end a person could go away and not even bother in the end. What are you talking about when you're saying better access?
Well, waiting times are part of it, and we have to be mindful that the level of waiting times, as you allude to there, is a problem, and it increases a sense of worthlessness, desperation, and depression for people. They feel their self-worth will decrease by not being seen. The key thing is to improve the waiting times, but also we have to be mindful that the demand is massive, and it's only going to be rising with more public health campaigns like the Heads Together, for instance. And the target is only to meet 25%. Currently, it's about 16-17% that are being seen. So the demand is massive. But once someone does get seen, I think psychotherapists would like to see that it's a range of therapies, that it's not just the CBT route, because not all psychotherapists are trained in that CBT framework.
Dr. Mark Bush, that does seem to be the big question mark, doesn't it? Particularly at the moment in the mental health service. More and more people are speaking up about their problems, whether it be a depression, whether it be an eating disorder. There are so many different types of mental health problems. But once they've spoken up, they're brave enough to go to their GP, there just isn't the care for them after that. You can speak up about your mental health problem, but there is nowhere for you to go. Where do you think the government resources should be going?
So I think it's really welcome that the government's saying that they want to put more emphasis on general practice, make sure that general practitioners understand how to support people who come to their surgeries. And rightly, there's been a focus on A&E for those people who turn up to the system in crisis. But really what we need is frontline early intervention support. That means support within schools, as the government's been rolling out, but also make sure that people can get access early on to quality, as we were just hearing, therapy within the community that delays the need or stops the need for them going into hospital care.
No, but I just wonder how easy it's going to be to recruit the staff that will make these kind of changes. I mean, do you work within the NHS? Would you find it an attractive property? Because you mentioned about them trying to coax back the staff that have left the NHS in their thousands. Is it an attractive proposition at the moment? We're hearing about mental health nurses having to pay for their training.
Yes. I mean, I think I personally don't work within the NHS. I did a psychiatric placement in the NHS.
Could they entice you in with these offers?
I think, like anything, the devil will be in the detail around the what's on offer.
Money,
I mean,
basically.
Well, if you're looking at, I don't want to get too political, but looking at the pay cap and staff morale within the NHS, rising demand, workload, morale, stress management.
Doesn't sound very appealing, does it? So how's he going to get 21,000 people into these new roles?
Well, we've got to welcome extra funding, of course we do, and commissioners have got to be responsible for public money, for taxpayers' money, and they have to have an eye for what works, for value for money, evidence-based care. But if you've trained in psychotherapy, which I have 4 or 5 years, do you want to be streamlined down a CBT route, or do you want to offer more holistic therapy sessions?
OK, I'll just leave the last answer. We haven't got much time left to Dr. Mark Bush. I could see you nodding along there when we were talking about the attractiveness of working in the mental health service. Would it appeal to you? Obviously, it is a passion for people to help people with mental health issues, but they've got to afford to pay their own bills. They've got to look after their own welfare as well.
Look, staff in the NHS, and particularly within mental health, say they feel stretched, they feel exhausted. What we need to do is value these staff. They're delivering the most amazing care to children, young people, for the main. And what we need to do is ensure that they have all the resources they need to create the next generation of mental health services, because ultimately it's that that's going to support people's well-being in the long term.
OK, Dr. Mark Bush, Policy Chief at Young Minds, and Noel Bell, psychotherapist, psychologist and former social worker. Thank you very much.
Oh, really good point there, SJ. Ultimately, it just comes down to money. You know, rightfully so. You need to pay your bills. You've got families, you need to look after them.
You need to be incentivised in your job, don't you?
It all comes down to that in the end. OK, you're watching Sunrise, coming up after the break.